healthcare facilities, private and public, must be licensed by the Health Professions Council of Zambia, HPCZ, to operate legally. Report illegal facilities or suspicious medical practices to HPCZ. Together, we can safeguard healthcare standards. Did you know it is illegal to practice as a healthcare practitioner in Zambia without registration and a valid annual practicing certificate from the Health Professions Council of Zambia? Failure to display one's valid practicing license is an offense. Report unregistered practitioners today. Call us on 0770-023-624 or email info@hpcz.org.zm. HPCZ, promoting compliance in healthcare and training standards.
My guest this morning happens to be the HPCZ Inspections and Compliance Officer. That's Ms. Hildah Lyamba. Good morning and welcome to the show.
Good morning, Mr. Kalwani, and good morning to our listeners.
Great, good to see you. How is HPCZ?
HPCZ is okay. Thank you so much.
So let's get the ball rolling right now. Just explain to us in detail what is continuous professional development, that's CPD.
Thank you so much, Mr. Kalwani, for that very important question. So when we talk of CPD, which is short for continuous professional development, we are referring to activities that health practitioners engage in order to develop and enhance their competences, skills, and knowledge to stay relevant and up to date in their chosen careers throughout their lifetime. Mm-hmm. So these are lifelong learning activities that they are supposed to undertake in order to grow and refine their professional skills.
Right, fantastic. As you heard earlier on, we are looking at CPD, that's importance of continuous professional development for health practitioners right here on Radio 4 on the HPCZ radio show. My guest is Ms. Lyamba right here in the studio. Why is it important for the health practitioners to undergo CPD?
Thank you so much for that question. So firstly, I must mention that healthcare is a very dynamic sector. Mm-hmm. Nothing stays the same for years.
Right.
It's a field that is constantly evolving. There are new technologies that come on board. There are new innovations. There are emerging diseases, as well as shifts in population health needs. Therefore, practitioners undertaking continuous professional development activities ensures that our practitioners remain equipped and are up to date in terms of knowledge, competences, and skills mm-hmm. that are relevant to their chosen professions in order for them to deliver safe, patient-centered, and evidence-based practice. I must also mention that HPCZ is legally mandated to ensure that practitioners undergo CPD as provided for in Section 20 of the Health Professions Act number 17 of 2024, which makes it a requirement for renewal. So basically, practitioners are required to undergo some form of CPD for them to be allowed to renew their annual practicing certificates. I must also mention that the CPD that we are discussing today is something that should be relevant to one's field mm-hmm. of practice.
Right.
So for example, you can be a pharmacist and you may undergo some short trainings, maybe in finance or other sectors. Mm-hmm. But the CPD that we are looking at, which we can consider for renewing your license, is that which is relevant to your field of practice, the field of pharmacy in this case. Mm-hmm. Yes.
Well, fantastic. We'll go for a break. We'll be right back shortly right here on the HPCZ radio program.
All healthcare facilities, private and public, must be licensed by the Health Professions Council of Zambia, HPCZ, to operate legally. Report illegal facilities or suspicious medical practices to HPCZ. Together, we can safeguard healthcare standards. Did you know it is illegal to practice as a healthcare practitioner in Zambia without registration and a valid annual practicing certificate from the Health Professions Council of Zambia? Failure to display one's valid practicing license is an offense. Report unregistered practitioners today. Call us on 0770-023-624 or email info@hpcz.org.zm. HPCZ, promoting compliance in healthcare and training standards.
That's right. Welcome back right here. So HPCZ requires practitioners to have CPD points before their license can be renewed. Why is it so?
Thank you so much for the question, Mr. Kalwani. So firstly, I should mention that HPCZ has a mandate of protecting the public, okay, in terms of the services that they access from the health sector. And we do this by promoting quality healthcare provision by both the practitioners that are delivering these services, as well as the healthcare facilities that these practitioners are working in. Therefore, HPCZ requires that practitioners should do these CPDs as outlined by the Health Professions Act as a mandatory requirement. And therefore, HPCZ uses the requirement of practitioners accumulating CPD points as a quality assurance measure for us to satisfy ourselves that practitioners are actually updated in terms of their skills, competences, and knowledge. And that is done every year for them to be allowed to renew their practicing certificates.
Wow. So what is the maximum CPD points that one needs to accumulate per year to renew their practicing certificate?
All right. So
or their license?
So there's no maximum, but we require a minimum of 100 points per practitioner. So these are points that they should acquire throughout the year. So what practitioners are required to do is that at the beginning of the year, they become intentional and make plans of how they are going to acquire these CPD points, such that by the time the year is ending and they are required to renew their license, they should have acquired at least 100.
100 points.
But basically, we encourage them to achieve beyond the 100 because we are looking at them sharpening and broadening their skills and knowledge. So it's actually advisable that they do more than 100.
Okay.
Yes.
Wow, that's fantastic. So, as when you come back to the activities, we just want you to tell us some of the activities that constitute the CPD and how is it organized by HPCZ? All
right. Thank you so much. So, like I mentioned in my opening remarks, we are mandated to regulate CPD provision as provided for in Part 5 of the Health Professions Act number 17 of 2024, which provides a legal framework of how CPD providers will be approved and matters of compliance as well as quality assurance. So we have a framework which allows for numerous types of CPD activities that practitioners can undertake. But I must mention that the providers of these CPDs are supposed to be approved by HPCZ as per requirement in the law. So some of the ways that one can acquire CPD or undergo CPD activities is by attending workshops, conferences, webinars, seminars, clinical meetings for those that are working in hospital or clinic setups. Practitioners can also undergo short courses. These are courses that range between 2 to 12 weeks in relevant fields of health. Then you can also undergo CPD through authoring of books. Again, we are talking about books that are relevant to your field of practice. Authoring a book such as a novel will not count for the CPD that we are discussing today. You have to author a book that is relevant to your healthcare practice.
Great.
Then there are other activities such as peer-reviewed publications. These are research papers. Then also being part of technical working groups. If you are assigned such, it counts as CPD. And also when you are upgrading your studies. So for example, if you are a holder of a diploma and you enroll into a degree program to upgrade, that will count for the CPD. And also if you already have a degree and you enroll to upgrade to a master's or another postgraduate training, that will count for CPD. So those are some of the examples of activities you can do. Okay, great. So can you renew the annual practicing certificate without CPD points? Or are there any expectation on that? Okay, so firstly, like I have mentioned in the earlier stages, it's a mandatory requirement by law. You are supposed to have accumulated relevant CPD for you to be renewed. However, we have a few exceptions and these include practitioners who are registered specialists. So these are practitioners who have been on our register They've moved from their, for example, provisional registration to full registration, and now they've acquired a postgraduate qualification, and they come and apply to be registered as specialists. So such, we exempt them from submitting the CPD points currently. And another category is that of lecturers. So these are practitioners who are involved in teaching activities, whether at college or university level. Those we exempt them from submitting CPD points currently. But I must also mention that currently the council is reviewing the CPD guidelines. They are just awaiting validation and approval, and we expect to have some changes in terms of how we will look at CPD.
Right. So do you think healthcare facilities are doing enough to support the CPD?
Currently, I would say they are doing something, but I think they could do better. In the current situation, we've seen that facilities are supporting practitioners that are employees in their institutions to undergo CPD in form of clinical meetings, sending them for certain workshops and short trainings. But in the eyes of the regulator, we hope that facilities could do better by coming on board to also be approved as CPD providers. We are calling on health facilities, private entities, NGOs, as well as even regular training institutions like universities and colleges to continue to come on board and be approved as CPD providers.
Wow, fantastic. So as we end the program, where can the health practitioners access the HPCZ CPD from the record of CPD activities?
Okay, thank you so much, Mr. Kalwani. So first and foremost, we do have a website. They can simply visit www.hpcz.org.zm, and from there they can download the CPD form. Secondly, they can also make a request through our official email, which is info@hpcz.org.zm, or they can contact our customer care lines or physically visit any of our 4 offices, which include our Lusaka head office and Lusaka hub, which is in Olympia Extension. They can also visit our Ndola office in Northrise. They can also visit our Livingston office in John Huntway off Airport Road in Livingston, or they can also visit the Kasama regional office, and from there they can obtain these CPD forms.
Wow, fantastic. It was a pleasure talking to you, Ms. Lyamba, right here. Anything else that you can share with the listeners before you go?
All right.
Yeah.
Thank you so much. So to our listeners, HPCZ exists because of you as members of the public. We are here to protect you from harmful health practices. So we remain open. Our offices are open. If you have any inquiries, if you have any complaints, we are available to provide the support that is needed. Thank you so much.
Wow, great. Thank you so much one more time for coming through right here. And of course, this morning I was talking to the HPCZ Inspections and Compliance Officer, that's Ms. Hildah Lyamba. And of course, we are looking at the importance of continuous professional development for health practitioners. Up until next week, I'm Boniface Kalwan saying bye-bye. God bless and enjoy the rest of the day.
All healthcare facilities, private and public, must be licensed by the Health Professions Council of Zambia, HPCZ, to operate legally. Report illegal facilities or suspicious medical practices to HPCZ. Together, we can safeguard healthcare standards. Did you know it is illegal to practice as a healthcare practitioner in Zambia without registration and a valid annual practicing certificate from the Health Professions Council of Zambia? Failure to display one's valid practicing license is an offense. Report unregistered practitioners today. Call us on 0770-023-624 or email info@hpcz.org.zm. HPCZ, promoting compliance in healthcare and training standards.